Hi, everyone, and welcome to This Week in Recovery. I'm Angela Gilgallen, and today I have with us Mark Powell, who is the Lackawanna County District Attorney and also the co-chairman of the Recovery Coalition. Mark Powell is going to discuss with us what happens when someone gets arrested on drug charges. Welcome, Mark Powell.
Thank you, Angela. My pleasure to be here.
So tell us, please, if you would, a lot of people, when they hear that a child or a family member has gotten arrested on drug charges, and some of those charges are very serious, but if you could walk us through the process on what happens when an individual gets arrested on a simple possession charge.
Sure. Our drug statutes are very serious, with very serious consequences. That dates back to the 70s with the war on drugs and very stiff penalties for people who both use and deal in drugs. I think our approach dealing with folks with use disorders certainly has changed, but the structure and the laws that are in place are still very serious and stem from a 50-year history. We no longer have mandatory minimum sentences in Pennsylvania, but the penalties and the enhancements for repeat crimes certainly are alarming. So when someone does get arrested, they are facing the potential for jail time, even with a possession charge. In Pennsylvania, possession of drugs is classified as an unclassified misdemeanor. First offense is punishable by $5,000 fine and 1 year in prison. So you're certainly risking jail time, but it would be at the county level. And there's a lot of opportunity for you, even if proven guilty of simple possession, to facing jail time, but also exploring some diversionary programs or looking at treatment in lieu of punishment. But that same crime, a possession charge on a second offense, is 3 times as severe. So as a second time offender, you're faced with a $15,000 fine and 3 years in jail. So the enhancement both for possession and possession with intent to deliver gets increasingly more severe if there's a subsequent offense.
Can you tell us a little, because I know Lackawanna County has a lot of diversion programs, such as all the specialty courts, treatment court, for example. Can you tell us a little bit more about those diversion programs?
Sure. We offer a great degree of diversionary programs and due in large part to the vision of Judge Baris when he was district attorney. So our drug court is 20 years old. It was one of the first and is one of the most successful in the country. We have great success with it. So when someone chooses treatment versus punishment and is given that privilege or opportunity to treat their disease, they're going to be given not only the opportunity, but the support to work through a program, avoid jail time, and have the opportunity to have the charges dismissed if they successfully complete that diversionary program. So we have our traditional drug court, which is the one I referenced before that was established 20 years ago. We have now mental health courts and codependency courts that try to address any mental illness or components of mental illness where someone is self-treating or using medication inappropriately. There are several, over a dozen, including a new program that we're putting in place called Fresh Start. And that's designed to get the low-level first-time offenders into a diversionary program where drug court really didn't have an opportunity to assist folks in that situation. So it was very good at assisting individuals who had a long criminal history and their lives were ruined with their use disorder, but someone who was just using drugs or just starting their addiction would be facing criminal charges that they couldn't even clear up or get expunged on their record. And this program is really designed to help those low-level offenders. So really our goal in a diversionary program is to get an assessment and treatment as soon as possible. When people are most vulnerable, when they're first arrested or first coming into the criminal justice system, whether that's an overdose, near overdose, or first time getting arrested with drugs, and trying to get that assessment to determine what their needs are. And if they choose recovery and a path of working a program, they're going to be given that opportunity to work that program rather than face jail. You know, jail may be necessary for certain individuals in certain situations and certainly for commercial dealers, but we want to give people an opportunity to treat their disease and get on a road to recovery so that we don't have a revolving door with people coming through the criminal justice system time and time again.
That's great. I know as a citizen of Scranton that I definitely have noticed a change in Lackawanna County as far as the diversion programs. And like you said, bridging that gap between an arrest and then having time before an individual is afforded the opportunity to get treatment. So I think having things such as like the pretrial assessment services has been very beneficial to our county. How effective would you say programs such as treatment court are?
Yeah, they're widely successful. So on a national average, there's probably a 20 to 30% recidivism after someone comes out of a program. That means they'll repeat or be back involved in the criminal justice system. In Lackawanna County, our numbers are as low as 10% or a 90% success rate. And while people are in the program, even a higher success rate with only a very small percentage, 3 or 4% of people failing while they're in the program itself. So it is wonderfully successful. And if anybody has been involved in recovery, they know that oftentimes failure is a part of the success. There are going to be temptations and relapses. The programs are designed to anticipate that, hold people accountable. There certainly are consequences for those type of actions, but also to provide the support necessary for long-term success. And that truly is the goal, right? To have sustained success, to enable people to pursue a life in recovery. And that involves some of the other great programs that we have in Lackawanna County, including our recovery bank and some of the other resources that help people get jobs and help people get transportation or help individuals with childcare needs, because really we need to treat someone who has a disease, and then we need to set them up for success, not for failure. And our treatment court in Lackawanna County is truly a model across the state and the nation.
Thank you for that. I really enjoyed how you brought in the accountability components. I think that's really important for individuals in the recovery process, to be able to held accountable. And I think some of the success with the treatment court systems is that you're able to hold an individual accountable, but in a productive, structured manner so that they are active in their treatment and in their recovery. It's not just, oh, you're going to jail and that's your consequence, that's your accountability. It's a little bit softer in the treatment world.
Sure. And so part of treatment court is you check in weekly or every couple weeks, depending on your risk or dependency needs. So the better you do, the less you have to check in. But there's constant reporting, much like you would have in any type of program. You have to work the program. Treatment court makes you work the program by mandatory court appearances. And in those court appearances, you give an update on how you're doing. Are you still employed? How are things going? Are you clean and sober? And so when there are problems, they're detected very early on, and then they're addressed. Now, sometimes that does mean someone is remanded to the prison, and there is certainly criminal consequences and punishment associated with their lapse in judgment. But it's only with repeat failures or someone who has really abandoned working the program where they're kicked out of drug court. going to be given the support to succeed. And that's really why the program works so well, because it forces people to work a program, and then the folks who are successful know that there are rewards for being clean and sober. And a lot of the support comes from other recovering individuals who are there to support. So a part of their recovery is to help folks who are going through the exact same program that they had succeeded from. So it's a magic formula. It works, and the proof is in the results. And certainly we're very proud of the results that come out of our drug court program.
Yes, and the support is so important. I know, as from working at T-Pals and having to represent clients and attending treatment court and seeing how effective having a weekly meeting, talking about a client, getting a really well-developed concept on what's going on with that client and how we can use our community resources to move that individual further into the recovery process, which is amazing that we are able to do that.
Yeah,
so
today there really are a lot of resources out there, so it's not like it was 10 years ago where folks didn't have the money or financial ability to get into a program. The resources are there. So if someone can't afford it, there are resources that will be provided to an individual to get that support. It really is a matter of seeking out the help. And you don't need the criminal justice system to do that or force that. So we encourage people to get help in rehab without the criminal justice system getting involved. But if the criminal justice system does get involved and you do find yourself arrested, you're going to be given the opportunity to get help, unless you are doing this for profit, unless you're bringing this into our community for purposes of financial gain and exposing others to risk. And in those situations, certainly the criminal consequences are very severe.
So like you've mentioned, the for-profit, in a sense, the drug dealers in Lackawanna County, which you have been very tough on, but you also have a great understanding of the disease of addiction. How do you, if you can talk to us a little bit about balancing punishment versus treatment?
Sure. From a prosecutor's standpoint, we know it's something we have to do on both levels, right? We have to reduce the supply and we have to reduce the demand. Reducing the demand is trying to get people with use disorders help, so they're not repeatedly having issues where they're using drugs and abusing drugs. But we also have to reduce the supply of drugs, and that sometimes presents some difficulty for us on who gets into a diversionary program or not, because sometimes folks deal to support their habit. So we really do look at these cases individually on a case-by-case basis. We look at their past criminal record. We look at the circumstances for the arrest. So if you're suffering from a use disorder and share drugs or sell drugs to support your own habit, there are going to be exceptions. We're going to permit that type of drug dealer into a diversionary program if they are committed not to use and not to sell. But if they have a repeat history of selling, or they're selling for profit, clearly that's the last person we want to involve in a diversionary program, because they're only exposing others to risk, people who are trying to make a sincere effort in recovery. So we scrutinize them. I'm sure we're not perfect, but we really do work hard to make that determination early and then monitor it, so that we are not involving people who are selling drugs into our diversionary programs. That's not the purpose of it. It's really to get folks with use disorders help, and get folks who are putting poison into our community behind bars, because they are very much a part of the problem. So it's a two-front attack, both supply and demand, and we will give equal attention to both of those efforts. But we are very serious about eliminating drugs in our community, not exposing our children to risk, and to try to prevent anybody from dealing in drugs or unfortunately dealing with drugs that result in an overdose, we really take a very firm and hard approach on those individuals to hold them accountable.
Thank you, District Attorney Powell, for a very informative interview. And thanks to all of you for watching This Week in Recovery.
It's really my pleasure, and the work we're doing is important. We have to reduce these numbers. We have to continue to fight, and we will devote all of the resources necessary to make a difference and help those individuals, most importantly, who have a use disorder and are in a position to recover and lead a good, productive life.